Welcome to Eye Contact. I'm Henahan. Chronic central serous chorioretinopathy is a leading cause of vision loss in the developed world. To date, there is no international consensus on the optimal treatment of chronic CSC. Today, we're fortunate to be joined by Dr. Camiel Boon of Leiden University, who has just presented for the first time the results of the PLACE trial, which may provide some answers to that question. Welcome, Dr. Boon.
Thank you.
Well, can you start by just giving us an idea of the PLACE trial design, protocol, and so on, and rationale?
Yes. Well, the PLACE trial was an investigator-initiated trial performed by 5 academic medical retina centers in Europe from 4 different countries. It involved the center of Oxford in the United Kingdom, Leiden and Amsterdam in the Netherlands, Cologne in Germany, and Paris, France. And what we wanted to find out if photodynamic therapy and micropulse laser treatment were equivalent, or if one of the two treatments was better for the treatment of chronic central serous chorioretinopathy. Because the striking thing is that thus far there are no large prospective randomized controlled trials for a relatively common disease like CSC. So we performed this prospective trial, and we were able to include 160 patients in total for the evaluation visit. And we included 80 patients per treatment arm, and patients were first assessed for a specific inclusion and exclusion criteria. And based on that, we performed a study in these centers.
So how did the two treatments compare?
Well, so first of all, we had a treatment arm with half-dose photodynamic therapy, and we treated on the basis of abnormalities on ICGA angiography, because we know from central serous chorioretinopathy that the choroid is affected most. So we wanted to treat the largest area and the primary tissue. And that's the same thing that we did in high-density subthreshold micropulse laser treatment, where we used 810 nanometer laser to treat with adjacent spots on the area on ICGA. And what we found is that the primary outcome parameter, which was a complete resolution of subretinal fluid, I think it's important to mention that because many studies find a reduction in fluid also a success. We wanted to go for a complete resolution of fluid, which we called anatomical success. We found that this parameter was significantly more commonly achieved in the PDT-treated group as compared to the micropulse laser group. And that was significant both at the first evaluation visit as well as the final evaluation visit 7 to 8 months after the treatment. We also looked at functional outcome parameters, 3 of them. The first one being ETDRS best corrected visual acuity. And we also found that at evaluation visit 1, this showed a significantly higher increase in the PDT group as compared to the micropulse laser group. But it was not statistically significant anymore at the final evaluation visit. The second functional outcome parameter was retinal sensitivity on microperimetry. We found that at both time points, so first evaluation visit and final follow-up, there was a statistically significantly higher increase in sensitivity of the retina in the PDT group as compared to the micropulse laser group. And finally, we went for a vision-related quality of life questionnaire to see if there was a difference between the two groups in this regard. And both groups saw a modest increase in vision-related quality of life questionnaire score, but there was no statistical difference between the two groups on this parameter.
So really, laser didn't do too badly. This PDT did a little better.
Yes. So I think we can conclude, the anatomical outcome was clearly in favor of half-dose PDT, and some of the functional parameters were. But it also reflects a bit our feeling in the clinic that patients may dry up with whatever treatment, but still they can have some residual complaints. But what we did find is that on microperimetry and at the first evaluation visit, best correct visual acuity, that this was in favor of PDT. So all in all, I think that we have clearly shown that half-dose PDT is superior over micropulse laser treatment for chronic central serous chorioretinopathy. And I think the next challenge among many things that we can analyze based on this study is to see if subgroups of these chronic central serous cases respond differently. So if, for instance, patients with chronic disease but more focal disease may respond differently to either of the both treatments than patients who have more extensive disease. We don't know it yet, but we're analyzing that, and we will definitely publish about that in the near future.
And what was the rationale for using the half-dose PDT? Is that standard of care?
Well, for central serous chorioretinopathy nowadays, it is standard of care to reduce the settings to half either the dose, the fluence, or the time. We thought that halving the dose would be most logical because you don't have to inject as much medication in the patient. And yes, we use half dose because it might have a safer profile, and it has been shown in larger retrospective studies that it is probably equally effective as compared to full dose PDT, but probably safer because there are probably less adverse events to be expected, although we didn't find any significant adverse events for both treatments in both groups.
Oh, good. I was going to ask that. And what about follow-up? Are you going to be following these patients, and if so, for how long?
Yes, that's a very interesting question because it would be really nice to see if also the number of recurrences, for instance, would be different between the two groups. So what we're going to do is a long-term follow-up study. So we're following up for another year between the two groups to see what the outcome is. What we're also doing is a crossover study. So the patients who didn't respond to PDT will have a crossover treatment to micropulse laser and vice versa, to see if patients who do not respond to PDT may respond to micropulse laser and the other way around. And this is called a replay study, and we expect to present those results also in about a year's time, so maybe at the next meeting.
So patient walks into the clinic today. Are you comfortable enough with the results to suggest PDT?
Personally, and I think most of the colleagues involved in the study agreed on that when we had our meeting yesterday, I would now definitely think that PDT has proven superior over micropulse laser in the treatment of chronic central serous. So I think this will significantly impact our clinical practice, but also reimbursement issues might be resolved based on this study, because there are many countries in Europe where the reimbursement of PDT as an off-label treatment for chronic central serous chorioretinopathy is a problem. But with this study in our hands, this might make things a bit easier with regard to reimbursement, because we want to have the best treatment for the patient.
Congratulations on a very interesting study.
Thank you.
Thank you for joining us. For more information on this and related topics, please visit us at eurotimes.org.